Hi, everyone. We are going to get started very shortly. I just wanted to go ahead and get us online. Thank you for joining Life and Death Wellness, and we will start the presentation in just a few moments as people are joining the webinar. So I just give you a little bit of what we're doing tonight. This is our monthly webinar series put on by Life and Death Wellness. We are a 501c3 nonprofit that's established in Hawaii, and our mission is basically to educate and support around all life matters, but especially the end. And so we try to bring something every month that can empower life and also empower our deaths because we're all going to get there someday. So you're actually joining the healing power of medical cannabis with Dr. Charlotte Charfen, and that's me. So I'm going to be talking to you guys all about as much as I can get in under an hour. This is a huge topic to try to explore. It's one that I am going to say I absolutely love to talk about, um, but I am certainly no expert. Okay, I do want to put that out there. The plant is so complex, but it is so absolutely inspiring. So just a little bit of housekeeping. This webinar is being recorded. Okay, I cannot see you. You can see me, I hope, and I hope you can hear me. But your voices, your faces will not be on this recording. Okay, it's a webinar. So it's only going to be me talking, but I will take questions. So if you have a question, please put it in the Q&A. And once I'm done with the presentation, I will get to as many questions as possible. Okay. And so just a little bit about myself, in case you've not met me yet. My name is Dr. Charlotte Charfen. I am lovingly called Dr. ChaCha, but I'm an emergency medicine physician. I have board certified in Detroit, got over 20 years ago. So that's been my practice of medicine mostly in my lifetime. In the last 5 years, once I moved to Hawaii, I have really stepped outside the emergency department. I still practice in the ER, but I really try to gear my private practice towards working with people that have serious illness or are at the end of their life. I also do some telehealth for just like urgent type things. But I also do medical cannabis education and certifications because I am in a legal medical state. And we'll talk a little bit about how I even got into this. But anyway, the goals of this presentation are education number one. That's the goal of life and death wellness in general, is to bring you solid education and dispel misinformation because it's everywhere, but especially when it comes to death and cannabis for some reason. Okay. You can't really talk about cannabis without talking about its history, its ancient history, and its more modern history. We're going to touch briefly on that. Um, you kind of want to know why it works in our body, right? I mean, I think that's super important to understand. So I'll go into the science of that, the very basic science. And then, of course, what are the benefits and what are the risks? Cannabis has risks, and I educate all my patients across that. Luckily, they're limited, but you need to know those. And how can you safely use cannabis if you are in a state where you're actually able to do so? And those are becoming more and more frequent. Every time I give this presentation, I have to update those states. And I did that today, and lo and behold, there's another state that just came online. But anyway, a little bit about my story and why I even care about medical cannabis. So yes, that is Montel Williams, but that's not why I got into medical cannabis. It's probably about 5 years ago, I would say. Prior to that, remember, I'm an emergency physician. So I see intoxications of all kinds. Usually it's alcohol, hardcore drugs. And of course, I see medical cannabis intoxications on occasion. And that's how I kind of thought of the plant. I never really thought of it as medicine, to be honest with you, until about 5 years ago when I was really delving into more work around end of life. And I went to a conference in Maui. It was a death doula conference. And this woman stood up and she threw a big cannabis plant on the screen and asked us how we felt. And my reaction was paranoid, right? I looked at it and I was like, what is she going to be talking about? And she asked us to really just kind of whatever stigma we were holding around the plant, to do our best to let it go and just to kind of open our eyes and open our minds and open our hearts. And so I started listening to her talk about cannabis as a medicine, especially as it was geared towards end of life patients. And I got so oh, what's the word? Embarrassed. I didn't know this basic medical information, and I was a physician. And I also got pretty inspired. And so I vowed then, I said, I want to know more. I've got to learn more. And luckily, in my wonderful, beautiful island, there was a nurse named Kristen who was wow. I mean, I call her my guru. She was a hospice nurse, an oncology nurse turned cannabis nurse, and she really, really educated me in the get go. And as I'm learning about all the benefits of medical cannabis, my partner's mother sustained a significant injury. She went in for what was supposed to be a very minor outpatient surgery to help her very chronic pain that she was living with. She's going to have a spinal stimulator placed, based to take 15 minutes. And hours later, she came out of that surgery paralyzed and in so much worse pain than she had ever been in her life. And I will never forget, here I am learning all these things about cannabis. And I say to my partner, it's neuroprotective. And of course, it helps for pain. Maybe this could help your mother. And he laughed at me, told me I was crazy. Said, my mother lives in a state where it's illegal. She's 70 something years old and she is not going to break the law. And I said, but we live in a state where it is legal and I'm a doctor and I can get her certified. And so long story, but she actually ended up coming to Hawaii so that we could actually help her. But the thing was, I didn't really know much at all. I had read all these articles, I had watched all these shows, but that's where this picture comes from. We went to a cannabis conference. We were determined we were going to learn everything we could about cannabis. But at the end of the day, when we left, I left very inspired because Montel Williams is a wonderful speaker, but I still didn't know what I wanted to know. I didn't know how to really help her. And thank God for Hawaii. Thank goodness for the people on this island that have been doing this work for a very long time. We didn't even have dispensaries then. So it was really difficult. But I will tell you, within 3 days, this woman that could not sleep, she hadn't slept in 12 years through the night, was sleeping through the night. Um, Her pain got significantly better. We were able to wean her off narcotics. She was on narcotics every 2 to 3 hours. She left walking after 4 months. And for me to watch the power of that plant, to watch the power of how it brought us all together to help support her. And I'm not saying she is by any means cured because she's not. She's going to live with chronic pain and a debility for the rest of her life. But it was absolutely eye opening to witness it firsthand. And so I, as a physician, said, I have to help other people. And people started to ask. And I could not, in good conscience, not help people with cannabis and learn more. And so that's part of what my practice is. I actually work with, it's a tool. It's not the end all be all, but it's definitely a tool I use for my patients. Now, the other stories, there's a million, right? And these are not my patients, by the way, but they could be. And they could be your sister or your child. These are the faces of the people that cannabis is appropriate for, not the whole Cheech and Chong thing that most people kind of put in their head as a stigma. But these are the people that our kids with seizures, debilitating seizures, people with debilitating cancers, debilitating pain. Those are the people that I just, my heart goes out to. And how can you as a physician not want to be a part of that help? However, I do have a disclosure to make. Um, Even though I live in a legal state, even though there are many legal states in our country, cannabis is still federally illegal in the United States. And we'll go into that. And why is that? And so you have to touch on history in order to understand that a little bit, because really it's only been the last 100 years that that's even been an issue. Okay. Cannabis sativa, that is the plant that we are discussing. Okay. It's been around almost 30 million years, long time, long history. Humans have probably been using it for at least 5 to 10,000 years, you'd say, right? The first actually documentation in text about cannabis being used as a medicine was in China, 2700 BC. I'm not going to go through all of this, but it's in the Bible, Book of Exodus. Egyptians definitely used it for glaucoma and inflammation. But when did cannabis really become a medicine in the United States? Because clearly it's not been that long ago. So there was a doctor named William O'Shaughnessy. He was actually in India practicing. He saw how the plant was being used for seizures and pain and different ailments. And he said, this is super interesting. So he took it back to the UK And I believe it was Queen Victoria that used it for her menstrual cramps. And so he was really the person that introduced cannabis, and it became part of the physician's pharmacopoeia. All right, so it's my Bible of drugs that I use in 1851. So that's when cannabis really started to be used as a medication in the United States of America. It was typically put in different concoctions. So it wasn't really just by itself. So if you look at the one on the right, you'll see there's some chloroform added. Okay, we don't do that anymore. But anyway, it was never smoked early on. It was always in like a tincture or a syrup is the way it was being used. There's lots of documentation of its use, even way back then. Um, for opium withdrawal of all things. And interesting enough, it started to kind of fall out of favor with physicians as morphine was introduced as a medication, and aspirin. And the reason for that is not because cannabis didn't work. The reason was because it was super hard to actually dose. So we didn't have big fancy laboratories back then, so we knew exactly what someone was getting. So the way that they would actually figure out a dose was they would give it to dogs, and then they would watch to see if they would fall down, and then they would know they hit the higher upper level of where they wanted to be in a concoction. So not super scientific, whereas morphine and aspirin had a really easy way to dose it. So that's when you started to see it kind of fall off, but it was still in the pharmacopoeia, still quite legal. But then the prohibitionists came around, right? And that was not just on cannabis. Initially, it was with alcohol. But the other thing you started to see was a huge influx of immigrants from Mexico between, I think, 1910 to 1920. They were fleeing. They were fleeing their country because of the government, and it was the Mexican immigrants that actually brought in their way of using cannabis, which was to smoke it, right? And it was called marijuana. That was their name, which is Maria y Juana, which means Mary Jane. But physicians and people in our country knew the plant by its name, cannabis. Okay, it did not become marijuana until the 1930s when a man by the name of Harry Anslinger, who became the first director of the Federal Bureau of Narcotics, decided he wanted it outlawed. Okay, so he convinced Congress, based on absolutely fabricated accounts, that anybody that was using this was becoming violent. They were going mad. This was the idea of reefer madness. And then it got even more disturbing than that. And I am not going to read these quotes out loud. You can read them for yourself, but these are true quotes out of this man's mouth. And so you want to talk about the xenophobia and the racism that goes along with the plant. It all came from him. And of course, he was not the only one to blame. There were other people that supported him. And this had to do with greed. It had to do with money. It had to do with race. There was so much that went into this. But guess who did oppose him? The American Medical Association. They said, no, this is a medication that is helpful. Yeah, we need more information and we need more studies, but we oppose what you're trying to do. Unfortunately, that fell on deaf ears, and Congress actually passed a law in 1941. So cannabis became illegal to manufacture. It became illegal to use. And you want to talk about the incarcerations that went up against people of color. If you looked at across the board, whites, blacks, and brown people all used cannabis about equally. But African Americans were 4 times higher to be incarcerated. People of Mexican descent, 20 times higher. So, and that still is today. Today, we're still seeing the effects of that. So, how did our history change? And this is the part of the story that I like. That other part's ugly, but I think we still need to know it in order to get past it and understand where a lot of the stigma comes from. But I'd say our history changed when we became compassionate human beings and really started to hear the voices of people that were suffering. And in the 70s, it was young cancer patients. They were reporting to their oncologists that, oh my goodness, I can smoke this cannabis. Well, they didn't call it, they probably called it marijuana, but I can smoke this and it works better than any drug you ever give me to keep me from vomiting. And then you had the AIDS epidemic. You had young men that were dying and wasting away. And that actually, they found that by using cannabis, they could increase their weight. They could increase their ability to tolerate a lot of the side effects of that disease. And then you can never forget our veterans, right? They had gone through the Vietnam War, they had gone through the Korean War, and here they are now self-medicating with cannabis for their PTSD. So veterans had a huge huge push on how we became more open to cannabis as a country. And then you have to always remember the kids, right? And it was the kids with cancer, it was the kids with seizure disorder that really started to open minds. So you have this groups of people that really started to change the minds and the hearts of our country. And so California became the first state to actually pass their law called the Compassionate Use Act, that legalized cannabis. They called it medical marijuana. I like to call it cannabis because that's the plant. Um, uh, and so they were the first state. Hawaii followed soon after that in 2000. That went through the legislature. So we started to see changes, and those changes are still rampant. They are happening right now as I speak. Interesting enough, there are 38 states plus DC that have medical legal cannabis laws. You might have to subtract one. Actually, interesting enough, Mississippi of all states, not known for its open mindedness, but does have the only federal legal crop where you can get cannabis to test. Weird enough, last November, by 74%, I believe they passed their law that they wanted to have access to medical cannabis. Unfortunately, one of the mayors, I forget from which city, went to the Supreme Court and said, no, this is not okay. And the Supreme Court overturned that ruling. So today, as I'm speaking, people are protesting in Mississippi. I think that's super awesome, because the woman I told you about, the woman that changed my world and the way I looked at cannabis, she left Mississippi to come to Hawaii to be able to access medical cannabis. So we're shifting, and that's a positive, but we still have a ways to go. I won't. Oh, so that's your history lesson. Okay. Now I'm going to give you a little bit of a science lesson, because it's super important if you really want to understand why does cannabis work in the body and why does it work for so many different things. This list that I am putting before you is not all inclusive. Okay. It's just, I think about what I could fit on the screen. But when I look at it, if somebody put this up in my medical school and said, I have a medicine that's going to treat every one of these ailments, I would laugh in their face. I would say, well, maybe you are smoking something. Maybe you are not right in your mind. How can one thing work for all of these types of disorders? Well, it's not magic. It's actually science. And so I want to talk to you a little bit about the science behind the cannabis. Okay. And there's some terms that I want you to know, or at least understand. And they're big words, but if you understand at least the idea behind them, then it makes sense why the plant works, right? So we're going to go over what the endocannabinoid system is. Okay. We all have one, and it's super, super important in our ability to balance ourselves. And then we're going to talk about what endocannabinoids are, our receptors that we have in our body, and phytocannabinoids. So those are the things I'm going to go over briefly right now. So what is the endocannabinoid system? Well, it's probably one of the most important systems you actually have in your body. It is real. Okay. I don't know, the literature's ridiculous now with the amounts of information you can get about the endocannabinoid system, but it is the largest neurotransmitter system in our body. And its main purpose is to maintain balance across all of our organ systems. And that's a huge feat if you think about it. So basically, when you're out of balance for whatever reason, some chronic stress that you've probably, because we all have it, right? And you're out of whack, this system is there to try to bring you back in balance. It's there to try to help if an illness is coming in or an injury has come in. And so it's got multiple parts. So it's composed of our endogenous or endocannabinoids, our receptors, and then all these crazy enzymes. I mean, and there's much more. I'm oversimplifying our endocannabinoid system. Okay. And then what are endocannabinoids? That means basically our own little cannabis products that we make ourselves. Yes, we make them. They are produced naturally in the body. And that what happens is they bind to special receptors that we have. Um, they were first discovered by Dr. Raphael Mechoulam. The first one he discovered was called anandamide, which means bliss. But this again, very basic. There's so many more, and they're being discovered all the time. But the first ones were in 92. That's when I graduated high school. I never heard about endocannabinoids or in the ECS system at all in medical school. But okay, you've got these little things floating around, but why? Well, because we have these receptors inside our bodies called cannabinoid receptors. The first one's isolated again by Dr. Mechoulam and team. were our CB1 and CB2 receptors. Again, tons more. And this is an oversimplification, but the way most people like to think about our receptors are the CB1s are in our nervous system, so our brain and our spinal cord, and all those nerves that go out. CB2s are more in our immune cells outside of our central nervous system. But they really are everywhere in the body. And the coolest thing is, even if you didn't have one and you needed it because you had an injury or something was out of balance, your body would know how to go and actually make make the receptors and the actual endocannabinoids, which is fabulous. I love this slide from Dr. Goody. Thank you, Dr. Goody, because it points out something I think is super important, especially as an emergency physician. Okay, so I told you CB1 receptors are mostly in the brain, their central nervous system. And you can see the different areas of the brain here and what they do. You can see memory, judgment, movement. Give somebody some cannabis, and we're looking at THC because right now, when anyway, I don't want to go too far down the rabbit hole, but THC certainly works on our CB1 and CB2 receptors. So you can look at the brain and see where it's going to light up if someone inhales or ingests a cannabinoid that has THC in it, or a cannabis product that has THC in it, I should say. The one place you're not going to see it light up is in the brainstem area. And why is that important? It's super important to me as an emergency physician because that's what controls our ability to breathe. Okay, that part of our brain. And so, what I deal with a lot of times are overdoses. That is a very common thing that an emergency physician would take care of. And opiate overdoses and benzodiazepine overdoses, the reason that people die is because they have those receptors in the brainstem and it makes them stop breathing. The reason no one will ever stop breathing or die from an overdose of cannabis, I don't care how much you take, you will never stop breathing, is because we do not have those receptors in that brainstem area that controls our breathing. And I think that's super important to understand because that goes to safety. I'm not saying you can't have some really bad side effects from a large amount of cannabis, but you're never going to stop breathing. This is a very busy slide that basically is an overview of the whole endocannabinoid system. So if you look at this little human to your right, you'll see where all the receptors are located, and there's a lot of crossover. Okay, but it's literally in every organ system, right? And then if you look over to the left, you can see the ones that we actually make. And if you look at the green area, those are the ones that the plants make. So we're going to talk a little bit about, okay, so we have this system inside of us. So what's up with this plant? How does it work within our system? So just a little bit of information about cannabis and how it works. Well, first of all, that's a plant's genus, which is divided into other strains. Okay, those strains are divided into hybrids, and then there's hundreds of ways that these plants are bred for specific qualities. Okay, and it is way, way beyond my knowledge to explain all that to you. There are people that do this for a living, and I am not one of them, but it's a science in and of itself as how you breed this plant and how powerful she is and all the different things that happen. She is a she, by the way. It's the female that makes all the good medicine. But anyway, historically, if you look at how the plant was bred, it wasn't for medicine, really. It was really for survival. So fiber for the hemp, or seeds for oil or food. Okay. But as we've come into this age of medicine and recreation, it's been bred differently. Recreationally, it's been bred for very high THC contents, but that's not the way the plant was actually kind of made millions of years ago, right? It was really more balanced. But for medicinal purposes, we kind of want to have the best of all worlds. I'd like a high THC plant, but I'd like a really high CBD plant, and then I'd like a balanced plant. So we can do that, and that's how it is kind of bred. But I'm not going to go in too much more into that. Um, this is an oversimplification again because cannabinoids, those phytocannabinoids, the ones that are in the plant, which we'll talk about, there's over 120. There's probably over 150. We're still actually figuring all of that out. But the two that you're going to hear the most about that you probably have already heard about are THC, which is the primary psychoactive component in the plant, but it does so much more than the psychoactivity, and CBD. Okay, those are the two that are the most well known, most studied. However, that plant is so complex. You take all the phytocannabinoids, over 120, then you throw in all the terpenes. Okay, I can't even go there, but there's a ridiculous amount. And then the flavonoids. That plant is a huge it's a huge ecosystem, and you can't just break it down into one, but we're doing that just for the purposes of this lecture. So, phytocannabinoids, that just means those cannabinoids that the plant actually makes. And again, THC, CBD being the most common. But why do we need them if we make our own? I mean, I just told you, your body makes your own basically cannabinoid. Why would I need to give myself something outside of my body? Well, if we lived in a perfect world where our bodies were perfectly balanced, maybe we wouldn't need to do that. But we live in a high stress world with a poor diet, poor exercise, and chronic stress. And you want to talk about bodies out of balance. So the phytocannabinoids, giving ourselves that exogenous cannabinoid, can actually bring our body back into balance. And that's why it can work in our bodies on so many different organs, because we have those receptors on so many different organs. Things that some people just don't realize, however, is when you're growing a plant, it's actually in the acid form. So if I were to grow a plant in my yard, which I've done, and I were to go out and pick the bud and eat it, I would not have the psychoactive, or I wouldn't get high, I guess is the way I'd put it, because it's in its acid form. You get a lot of wonderful properties and a lot of wonderful benefits, but in order for it to become into a neutral place, it's called decarboxylation. You have to either heat it or dry it out. And a lot of people don't realize that. So I just like to point that out. So let's talk about THC, right? The thing that makes me paranoid when I used to hear that word. Oh, that's the bad part of the plant. It's actually quite potent and quite important. It was actually isolated back in 1964. Do you want to guess by who? Dr. Raphael Mechoulam in his very small lab in Jerusalem. And it has been the most well known and studied. It is responsible for the psychoactive effects, but it's also responsible for so many of the medicinal properties. And it is a direct interactor of the Cb1 and Cb2. So it's kind of easier to follow THC and how it works. It actually makes more sense in my head. But you give your body that, and it's going to mimic what your body is supposed to be making in those areas. So that helps you maintain basically balance and health. And again, it's in all kinds of different bodily tissues. I like to point out what it does for the brain, because I think we all, or at least I grew up on your brain on drugs and the eggs and that kind of thing. And people think, oh, that's what cannabis does to your brain. It's actually a protector of your brain. Used appropriately, it protects your neurons, it protects cell growth. It does so much as a neuroprotectant. It's quite impressive. And of course, it does a lot of other things. And then there's CBD. Cannabidiol is the other word for it. And so people like to say it's not psychoactive. It actually is. It also works on the brain. That's why it is psychoactive, because it helps with seizures. It helps with different injuries to the brain. What it's not is non-impairing. So you can use CBD and not get that euphoria, not get as many of the side effects as you might when someone's using some THC or a plant that's got that. Okay. It also does very similar things. It works differently than THC does in the body, but it works similarly in that it helps anxiety and depression, pain, seizures, psychosis at high doses. Interesting enough, and those are in human studies. Um, it does so much. And I just put in, there's been this misconception, and I think it's because there's this CBD craze, that's the medicinal part and THC is the intoxicating part. And that is certainly misinformation. They are both medicinal. Okay. And they both need to be, in my opinion, if you can get them to work together, that's the better way to approach it. Um, I cannot hit every system in the body, but there's a couple I do want to speak about. And the nervous system, I've already talked a little bit about it, but I really want to reiterate how important cannabinoids are when it comes to our nervous system, our brain, our nerves, our ability to feel pain. It works wonders for inflammation, neuropathic pain, cancer pain, spasms, and it is a protectant. People that have had head injuries or strokes, it actually has been shown to be able to protect those areas that are being inflamed. And then long-term disease. So MS is a big one, multiple sclerosis, that you'll hear, that's Montel Williams. He's an MS patient, and this was about the only thing that would help him. He almost died of opiate abuse if it hadn't been from cannabis. Dementia, and I have to tell you, I've treated several patients now with cannabis, and usually my patients are cancer patients and pain patients. So the first time I got a patient that had severe dementia and I was asked to help her, I was pretty skeptical. And I'm going to tell you, it was mind blowing. She was a woman that in her entire life she was absolutely opposed to pharmaceuticals. She did not want them in her body, and so her power of attorney knew that and wanted to respect that. So when she got very advanced dementia and she got, unfortunately unsafe, the question became, how can we help her but still honor her? And so they approached me and said, how about, what do you think about cannabis? Now, I had read studies that had been great for certain cases, but I hadn't actually used it. And funny enough, I go to a conference, and that's all it's about. I go to this one conference that is talking about how well patients are doing in Alzheimer's units in California, because they can give it in the units to keep them safe, to keep them calm without over sedating them with the psychoactive pharmaceuticals that really don't work well. And so my introduction using it for dementia was pretty powerful. She was able to stay at home with caregivers and basically lived her last months with cannabis, coconut water, and a lot of love. And so that was pretty powerful for me. So I like to bring that up. The other thing are the anticonvulsant effects of both CBD, THC, and the whole plant. I have a patient. I don't do a lot of pediatrics, but of course, seizures can be devastating in children, absolutely devastating. And that's really what really, um, when I watched the story of Charlotte Figge, if you haven't seen Weed One, you should watch it. And watched a child having hundreds of seizures a day and put in hospice because, she was at the end of her life at about 3, to see that CBD could switch that. It made me such a full believer. She died at the age of 12. Um, when I had a patient in my emergency department who was a young kid and having back-to-back seizures, and the mom was so frustrated. I mean, she had tried everything. They'd gone to all the specialists. He'd been on multiple anti-seizure medicines and nothing was helping. And there I am taking care of him. And it's kind of hard in the ER. It's not like I'm like, hey, cannabis. I don't walk around holding a cannabis flag, but I felt super pulled to just mention to her, hey, have you considered CBD for your child? And I'm going to tell you, she almost got on her knees and kissed me. She goes, are you willing to talk to me about this? And I'm like, what do you mean? And she said, I have been asking my doctors if that would work, and I really want to try this, but nobody will talk to me about it. She said one of her neurologists actually yelled at her for even bringing it up. And so um, I worked with him. He did end up having to go back on certain seizure meds, but I've now been following him for 3 years, and he has been completely seizure free for the last year and a half, and off all of his seizure meds. So the only thing he's taking is a high dose CBD with a very minimal amount of THC. So that was really impressive to me, and how cannabis can work across all age groups. Anyway, I could go on and on and on. I can go on and on and on, or you could just listen to our federal government. I love to put this up because since cannabis is classified as a Schedule 1 by our federal government, which means there is no medicinal value to the plant, which is a bunch of malarkey. But that's what that basically, if you're in the Schedule 1 category, that puts you in the category with heroin. That's what the federal government, that's what our laws state. However, our US government has a federal patent for cannabinoids as medicine, as a neuroprotectant. So you can even look this up yourself, but that's just hypocrisy in my opinion. Um, of course, most people know cannabinoids, cannabis works for the GI system. It helps with nausea. It helps with increasing the appetite. It helps with vomiting. It does so much. One thing a lot of people don't know, and I actually didn't know this for the longest time, it's really actually helpful for liver disease. So if there's a scarred liver due to cirrhosis, cannabis can actually help improve that. Um, Cancer, a lot of the patients that I treat are cancer patients. So they're either going through treatments or they have a terminal cancer and they've elected not to seek any more medical treatments. And so I, hmm, this is a big topic for me because I think there's so many benefits that can come of using cannabis with patients that have cancer. So, if a person is going through treatments, we know chemo and radiation, the typical side effects. I mean, it's pretty painful, right? So it's a lot of vomiting, it's a lot of nausea, and there's neuropathy that goes. It burns the nerve cells. So using cannabis during treatments has actually been it's well documented. That's well versed in the research. It definitely helps with those symptoms, and I would encourage anybody that wants to try that to do it. It's not going to mess up your chemo and radiation. If anything, it may actually enhance it. The patients that I do warn about, and of course, all this needs to be talked about with your actual cancer doctor. They need to be on board with this. They need to know that you're using it. I would absolutely encourage dialogue, not trying to hide something like this. But immunotherapy is a place where you have to be a little bit careful. But overall, it can absolutely help treat symptoms. In animal studies, there's obviously a lot of research that shows it can actually be effective in stopping tumor growth. So it will stop the tumor from growing. It will cause the cancer cells to die, but leave the other cells perfectly healthy, the healthy ones. It can prevent blood vessels from growing that makes the tumor grow, and it can prevent the cancer from spreading to other parts of the body. That's pretty super impressive. Now, we have that in animal studies. That does not always translate to human studies, but we've shown it in research studies, which most of it is out of Israel and out of Spain, since we can't do those really robust studies in our country one day. But again, I tell people I would never say that cannabis can cure cancer, but there are plenty of anecdotal. There's plenty of cases of patients using cannabis alone or with traditional, treatment and doing well with it, even super aggressive. And I don't want to discount those stories because they're numerous. So I see cannabinoids and cancers working super well together. And if your oncologist or cancer doctor isn't versed in it, there are people out there that can actually help bridge that gap. So I just encourage anybody that has cancer or a family member that has cancer to really, really do your research and really make sure that you're getting a good product. These are the patients that I can oh my God, you have to go to a dispensary. You have to know what you're getting because your immune system is certainly compromised. And the last thing you want is to be getting a plant that could be contaminated. So, anyway, I could talk all day just about this. For my terminal patients, this is something that has been a godsend. When you are dying of cancer, when you are at the end of your life, um, it's super difficult on so many levels, right? I mean, it's not just the physical part, it's the emotional part. And cannabis can help with all of that. I have found that a lot of my patients can decrease the amount of opioids they are on. I had one that barely used any opioids, it only used cannabis to be able to control his symptoms. So I've seen the power of what it can do. And I bring that up as the next topic of cannabis and opiates. Um, and I guess this is the old school meaning. Doctor, I've heard that cannabis can be used for safe and effective pain management. And the doctor replies, maybe, but all I can prescribe you is a decade of opiate addiction and probably an early death. And it's funny, but it's not. It's so not. If you have paid attention at all to our world, you know that we are in a huge opiate crisis. I see it pretty much every time I walk into the emergency department. There are deaths beyond deaths when it comes to opiate misuse. And not even addiction. That's the thing is people don't realize when our metabolism changes, those drugs can build up in our system. There's so many accidental deaths that happen. And so, what I have found with cannabis, and there's plenty of studies that show it, is that you can absolutely taper somebody's opiates. You can get them off opiates using cannabis. And you can actually control their pain so that they're using less. You may not get them completely off, but for somebody that's living with chronic pain, if you add a little cannabis to their regimen, they won't need as much. And if you look at the states that now have recreational use or adult use, I guess you should say, you see a drop in their opiate use. So that's pretty powerful. Um, oh, yes, adverse effects. I would be silly not to talk about those with my patients or with you. So I love using cannabis as a medicine, but I respect it as a medicine. That means there's side effects to any medicine, anything you put in your body. I don't care if it comes from a plant or it comes from a pharmaceutical drug company. There's always going to be the potential for adverse effects, and we need to know them and so that we can mitigate them. When it comes to cannabis, luckily, they're not like opiates. They're not like benzos. They're not like the psychiatric drugs. They are actually have a lot less adverse effects, but there are certain people that might experience these worse. It doesn't matter that it might not kill them. They're super uncomfortable. So common ones though: dizziness, dry mouth, nausea, fatigue. Yes, you may get sleepy. They say euphoria is an adverse effect, but being happy and excited is not necessarily a bad thing. But sometimes it makes people uncomfortable to be happy. I don't get it. But anyway, so that those are the common ones, right? That people are going to complain about. This is what the Journal of American Medical Association put out. Some of the less common ones are depression, because actually it should usually do the opposite. But you can see an adverse or the opposite, like the vomiting, right? Cannabis should be controlling vomiting, but in certain people, it will do the opposite. Anxiety, confusion, hallucinations, and paranoia. Now, that's pretty serious, right? If you start hallucinating and you're completely paranoid, you can do some silly things. You can do some dangerous things, I guess I should say. So that's not something to take lightly. You'll usually see those in new users, and it's usually from ingestion. And we'll talk a little bit more about that. But that's certainly for somebody that's cannabis naive. That's really something to make sure they understand when it comes to edibles, that that's not where they want to start. And the thing about it is, because I this is what I treat in the ER. Like, you don't see a lot of angry cannabis patients. You see that they are freaked out. They have either somebody slipped them a cookie or they ate too much of a cookie and now they think they're dying. And that's how I end up seeing them in the emergency department. The beautiful thing about that is you can usually talk that person down, right? You turn off the lights. You actually maybe put on some soothing music. You really just kind of talk. Rarely do I even have to give them anything to bring them down because they're so paranoid. They don't want anything in their system. So usually it's just a lot of talk and then reassurance. But it can be scary for people. So I don't want to minimize that. For the cardiac patients, there is an issue when it comes to the heart rate and blood pressure. So that's anybody like that has significant cardiac issues. They shouldn't be vaping or smoking. Ingestion is usually fine. You're not going to see that as much. And again, these side effects or adverse effects are going to usually be in people that are kind of cannabis naive. Okay. And they're in a weird environment. So set and setting is super important, or they've consumed a large dose for their body, and everybody's body is different. There are certain people like myself that are super sensitive to THC. So you have to be super careful or you're going to experience some of these things. What I find interesting, and this is anecdotal from my clientele, is my elderly population completely the opposite. Where I thought that they would be like needing really small doses of THC, they can tolerate much higher doses of THC. Okay, so I want to hurry up and get to the end of this so you guys can ask some questions. So, how do you use cannabis and how do you use it safely? So, number one is safe use is super important to me. I don't care. And that doesn't just apply to cannabis, that applies to drugs, any drug, any pharmaceutical drug that you are bringing to your home. It needs to put away safely out of the hands of anyone else. It's your medication, right? So you need to be in control of that, but especially around children and animals. Um, you know, we do see cannabis ingestions come in with kids, but usually it's actually mama's grandma's blood pressure medicine or somebody's benzo. So, but again, safety is super important. So making sure you're storing whatever form you're using out of the hands of anyone else is super important. I am not a huge fan of smoking or vaping. I'm just going to tell you that, and I mean that not because of the stigma, but just because of the way that the meds work. So I don't think you should have to chase your pain. I don't think you should have to chase your symptoms. And so I'm a big believer in tinctures, which you're going to see on the left side of the screen. Maybe it's your right side. I don't know. But so dosing at least maybe twice a day with a tincture. So that's drops that go under the tongue. You hold it and then you swallow it. That just gives better dosing. And what happens is it just is a better kind of curve as to how it's going to stay in your body. I think of smoking or vaping, and I do not mean vaping any kind of oils because that's toxic. I don't even care if it's organic. Please don't do that. That's what you see in the upper part of your screen. You're asking for issues in your lungs. But if you vape whole flower, that's a different story. And that can be beneficial for people that have acute pain, meaning I don't have 40 minutes to wait. I am in severe, severe pain. Those are my like metastatic bone mets patients. Or I am puking my guts up. Oh my gosh, I cannot get control of this. I can't even keep anything down. Those patients certainly benefit from vaping or smoking. When you smoke, you're burning. So there's toxins that go into the lungs. Fine. The other thing you're doing is you're losing about 40% of the medicine, which I think is just a waste. And you're burning the terpenes off. So that's another reason I'm just not a fan of smoking or vaping. But it does have its place. So do edibles. Now, again, uh, you have to be careful, especially if you're cannabis naive, because that's where people will get into trouble with those adverse effects that I mentioned. And I always tell my patients, don't forget the creams and the salves. That's actually, especially in the elderly population, that gets they're a little bit afraid of ingesting or vaping or whatever. It's amazing if you can get a good cream. That's usually you need some THC in it, but rubbing it on those areas, especially for like your rheumatoid arthritis patients, can be extremely helpful. We are running out of time, so I could talk all day about this, but I also need to give a lot of gratitude because if it wasn't for these two men, I wouldn't know half the stuff. And I should throw Kristen. I should throw a lot of people up here, but the Godfather, Dr. Raphael Meshulam. You've heard me mention his name in this talk. He's 90 years old. I got to meet him his last visit to the United States of America. He lives in Israel. He is the man that really has done more research in this field than anyone else. He is the reason we understand it as a medicine. He is the reason a lot of this misinformation has been dispelled. And so it was my honor to get to just shake his hand and tell him thank you for his contribution to this world and the lives that he has saved because of his research. To the right, you're going to see Dr. Dustin Sulak. Also an amazing physician. He's an osteopathic physician out of Maine. Healer.com is his website. I would highly recommend him. A lot of what I talked about today, he goes into so much more depth if you want to know that. So he's great for clinicians. He's great for anybody that's interested in the medical cannabis aspect, but he's also great for patients. So he teaches dosing. He safely, slowly. I mean, it's start low, go slow. I mean, that's his motto. But he's just another great. I consider him a mentor, just somebody that's super, super balanced. He knows all the research. He does monthly webinars where he talks about all the latest research, yet he balances that with his 18,000 plus patients that he's consulted with medical cannabis. And so just a good balance. So anyway, um, I have talked enough. So I am going to stop sharing and I'm going to see, does anybody have any questions? Oh gosh, I can't. Oh, now that I'm big on the screen, it's a lot of busyness in my background. Sorry. So, okay. So, questions, just put them in the box if anybody has questions. And resources. Yeah. So, I already told you about healer.com. That's definitely a resource I would recommend. A lot of people ask me, I'm in a state where there's not physicians, they're not clinicians doing that. How do I find out information? There is a nonprofit organization. It's called leaf411.org. I will send this out in the follow-up news or little email. But that is a nurse-driven organization. So you can actually call up and ask questions and talk about your health. And they're experts in the field of cannabis. So it's a good place to start. The realm of caring.org is another good resource that I think is super, super fabulous. And what else? Do you have concerns when it comes to, do you have concerns when it comes to recreational laws? Um, yes and no. So I don't live in a state that's recreational. I only live in a state that's medicinal. So I do have some concerns. The biggest one is that the medicinal patients are going to fall off the radar because the money's where the THC is. I hate to say it that way, but that is truly THC sells. And so that's, those plants are bred recreational plants. What I don't want to see happen is that our medicinal patients get left out, because our medicinal patients that are using this for medicine, don't, I mean, some need high THC, but really and truly, most don't. I'm making kind of a blanket statement, but I want them to have access to all of it. So that means high THC to CBD, balanced THC to CBD, and then high CBD to THC. So that's my concern with recreational. What else? Of course, you always, anytime, and this is where being adults super important is, of course, there can be misuse. I see misuse all the time when it comes to alcohol, which has been, legal forever. But I mean, and that's pretty significant. So, of course, there will be misuse. There's no doubt in my mind. There is, no matter what state you're in. One of the things my colleagues that work in recreational states, that they note is an increase in patients that have what's called hyperemesis syndrome that you can see with cannabis, and that's from long-term misuse. You don't see that in patients that are using tinctures, that are using it medicinally and using it under the supervision of a clinician. But it's pretty sad, actually. They come in completely the opposite, puking their guts out. I mean, just like, it sounds like an alien's coming out of their bodies. And really, the only thing that works for them are hot showers and like capsaicin creams, and stopping smoking, and to tell one of these patients that your problem is that you smoke too much cannabis is just completely counterintuitive to them, because they're used to it working for them and helping them with anxiety and helping them with nausea and vomiting. But you will see an increase in that in recreational states for sure. Positives, I think, are economy boosting. I mean, there's no doubt about it. What I'd love to see is that we have enough states that are recreational that the federal government can stop ignoring the fact that most people actually want this to be a thing, so that we can actually do more research. All these cancer things, there's so many unknowns, and if we had access to be able to do appropriate research, we could just gosh, we could go so much farther. So yeah, there's positives and negatives to both. Let's see. um, Good question. Can you explain about K2, or the the synthetic stuff? Yeah. So this is another thing I see in the emergency department. Luckily, I don't see it as much in Hawaii. I used to see it a lot in Florida. There's something called K2 and spice, and I'm sure it's got other names. And it gets confused that they call it like a synthetic cannabis or like marijuana, but it's because they're cannabinoids. There's some synthetic cannabinoids that are made on this, but literally it's like they take this, like it looks like cannabis because they make it like a shake, and then they spray it with a bunch of toxins and synthetic cannabinoids, and then it's sold in head shops, and I think you could get it in gas stations at one point, and then people smoke it. Um, and it makes people completely insane, completely psychotic, superhuman strength. It is not true cannabis at any. There's just not. It's a complete misconception just because they're synthetic cannabinoids. This is it's super hard to deal with in the emergency setting. I've had tiny 12-year-olds that look like, I mean, literally like the Hulk, that it took so many drugs to knock them down. So it's a good question, but they're not. There's one is synthetic and a lot of mixed up junk, and one comes from the earth and is a whole plant that's certainly has none of those kind of side effects. Um, okay, good question. What if you live in a state that's not legal? How can you supplement your endocannabinoid system? And there are ways. And what if you live in a state that it is legal? You can do things to help your endocannabinoid system. You don't actually just have to use cannabis. Okay. Um, if you want to, great, but there are things you can do. So think about your body, think about how it gets out of balance, and living an American lifestyle, usually diet's number one, right? So diet, chronic stress, lack of exercise, that's how I think of ourselves as humans, especially in the US. So what can you do to supplement your diet that's going to boost your endocannabinoid system? Well, we definitely have like an omega-3 to omega-6 like screwed up ratios. So eating things that are higher, getting a balanced diet. So hemp seeds are good. I'm not a big fan of little tiny cold water fish like sardines, but it's certainly a great source. Krill, there's supplements, of course. I'm a big fan of maca. So I put maca powder in my smoothies. That will absolutely boost your endocannabinoid system. Chocolate, I wouldn't overeat the chocolate, but it helps as well. What else? Echinacea. So there's things you can do to help in your diet. Obviously, cutting out crap helps too, but whatever. And then, of course, exercise. And it's Dr. Sulak points this out. I love it because it's not forced exercise. First of all, so if you're forcing yourself to exercise and you hate it, it is not going to boost. Studies show it's not going to boost your endocannabinoid system. However, if you're doing moderate to high intensity and it's something that you absolutely enjoy, then that will actually help boost your endocannabinoid system. Um, Fasting does it. I don't do cold water immersions and dips and stuff, but people swear by it. It actually boosts your endocannabinoid system. Um, Socialization. Yeah, which, think about it. We've lived through a pandemic where we've been completely isolated. Humans are meant to socialize. And so getting back safely to being able to socially play with your friends is actually super important and super boosting for the endocannabinoid system. So, um, I do not see any other questions. And I think we are actually at the end. So you will get a follow up email that will have this recording. It will be on the Life and Death Wellness website as well. And when I can get it uploaded, again, we are a nonprofit. Please check us out, ldwellness.org. Please join our mailing list, tell your friends, support us that way. We love money too. We're grassroots. So if you can donate, that's perfect. But any way to help support us, because our goal is really to continue doing these webinars monthly. Super important for us. It's super a way to really reach out. And if there's things you want to hear about, please just send us an email, info@ldwellness.org, and we will try to get those things out that people find interesting. We're taking a break in June. Everybody's going on a much needed respite, but we'll be back in July. I'm blanking on the date. I think it's July 14th, but we have a the spiritual chaplain from North Hawaii Hospice will be talking to us in July about end of life issues and the dynamics around that and culturally. So please look out for that coming up. Ooh, I'm supposed to do a drawing. So for the people that actually signed up for this webinar, there were several. I am going to stick my hand over here in this magic pot and I'm going to draw some names. Hold on. And you will get CBD from Healer because I have samples, because that's who I use, but I am not trying to tell people what to use. But okay, I'm not going to say your full name. I'm just going to tell you that Glendon G has been chosen. And so you will get an email from us asking for your address, and we will send you a sample. I'm going to choose one more. And Margie L. Okay, super cool. So you both will get emails, and thank you all for signing up. Thank you for being a part of our webinars. Yeah, it's pretty cool to be able to do these things. That is one great thing about the pandemic, is that we're able to reach more people with our education. As much as we want to be back in person, our space is small. So we'll always, I think, continue to do webinars in a way that it's a hybrid eventually. So anyway, thank you for joining us. And you can always reach out. I check the emails. My assistant checks the emails, info@ldwellness.org. Have a beautiful, blessed evening.